Okay, so we're going to talk a little bit more about the Greenfield Farms approach, basically from a One Health perspective. So we're first going to talk about a little bit about the salmonella transmission. The point of contact you really want to think about is how everything is, the tie-in is the stream water. So when you're having other animals, that's affecting their environment. And using that stream water that's being affected, this is going to ultimately affect those, causing more community spread. But you also have to understand that the primary cause why the stream water is being affected is because farm animals are both infecting the milk as well, which can, contribute to the human illness, but also affecting the animal manure. And whenever you're having irrigation or heavy runoff, this is what's causing the contamination in the stream water. And just like any other sources of water, this is going to be spreading in, to the different communities around us and to different animals. So now we can talk a little bit about the roles in the outbreak. So we're having in three different areas, from the animals, humans, and environment. So from the animals' point of view, we know that our primary reservoir is the cows that are being infected with the mastitis. But then we also know that, infected poultry can also contribute to the environment having contamination as well. And we also know that animals shed this also bacteria in the process into the environment as well. From a human's perspective, when we're dealing with infected animals, we have to keep in mind of the hygiene practices. If they're not being followed in the correct protocol, that can cause more of an outbreak. And you also have to understand that all of that unpasteurized milk is also affecting, not only just like the milk, but community members as well that have been exposed to it. And because we also talked about the stream water, anything that is coming in contact with that would also be affected. In terms of the environment, we know that because of the stream water being contaminated, it's from due to the manure application. So the stream is acting as like that vector between the farm and the community. And so when you're having this heavy rainfall, the runoff just causes more of an outbreak. And if you're not having adequate waste management, it's just not making it more contained. So let's talk a little bit more about the stakeholder engagement. The number one thing, I guess, in this case is farm owners. They have to be very cooperative with the investigations and make sure that their milk is being processed per protocol. Farm workers have to continue following, hygiene protocols, reporting any illnesses, whether that be from the animal perspective or from the human perspective. And the local health department are the ones that are going to be coordinating the testing and really being the lead on the investigation. Veterinarians is pretty obvious. They're the ones that are assessing the animal health and making sure that they're implementing the right strategies. Others are, things like environmental health officers. So they're basically testing the soil, see how that's working, coming up with any containment solutions, making sure that the outbreak is not being spread, very severely, trying to make it more contained. Medical officers, anyone that's, any patient that is infected, they're the ones that are going to be taking the lead on that. From a schools and food perspectives, they're going to be basically handling all the contaminated products. And the local government is basically facilitating any communication that's happening with all of these stakeholder engagements and coordinating any of the resources they have. So the action plan we have kind of divvied up into immediate response, medium, and then long term. So for me, the immediate response is from the 0 to 30 days, intervention. And we've kind of divided up from a human health intervention, animal health intervention, environmental health intervention. So what that really means is from, when we're talking about human health, is making sure that medical treatment is being given to everyone that is affected in a very standardized way. The other part of that is making sure the public is aware of, what is happening, making sure that the alerts are, given, and as well as also educating people on safe food handling. In terms of animal health interventions, it's kind of like the same thing as how we're doing with the humans, making sure we're following all the protocol and making sure that the milk and water are in safe supply. And then from an environmental health standpoint, making sure that the source is being controlled and we're recalling any products that that we know of. The medium term actions is more a little bit more longer term from the 1 to 6 month standpoint. But what this really means is trying to see, further analyzing the outbreak, seeing why exactly did it happen, what are the contributing factors, seeing if there's any follow-up care on the patients that are infected, and continuing on with that education because that's more of a lifelong process. For animal health, it's still making sure that they're up to date on their vaccinations and if their health is, doing much better. Environmental health, we're going to take a look at all the water resources, making sure that they're treated, adequately and we're managing it well, and just having that continued monitoring process. Now we're going to look at the very long-term prevention strategies, which is greater than 6 months. So we're kind of looking at it from, integrated systems, agriculture, and education and research. So, for an integrated system standpoint, we want to make sure that the community is engaged, making sure that the board is having representation from every stakeholder group, making sure that, policies are starting to being developed. So making sure that, this type of thing is not happening in the future again. In terms of agriculture, we want to make sure that, water conservation is in place because like I talked about, stream water is kind of like that primary vector for distribution of this. So we want to make sure that, we're conserving as much as possible and making sure that other chemical inputs are kept at bay. As always, like I said, education and research is going to be an ongoing thing, making sure that the schools are trained on food safety education, but also farmers are educated on, disease prevention. And then now from a monitoring and evaluation standpoint, we want to, make sure we're tracking all the incidents of GI illnesses, from epidemiological standpoint. Also making sure that, all the animals are doing well, making sure that they're not contributing to the morbidity and mortality rate. Regular testing, whether that means of the soil, the water, and the air, but also understanding the economic impact, making sure that most of our energy is towards prevention measures and making sure that that outweighs the cost of the outbreak. So in terms of like reflection, oops. In terms of reflections, there's a few things that are, benefits of integration. So we get a little bit more of a comprehensive understanding, resource efficiency, and prevention focus. So in this case, when I talk about understanding, we're kind of seeing how multiple pathways are kind of interlinked together and are affecting many different areas, whether that be humans, environment itself, or even between animals and herds. It's also giving us further insight into how to allocate and use our resources efficiently because from an economic standpoint, we want to make sure that we're not over our budget, but we're also planned for the future as well. And this kind of also highlights how important prevention is, as the main study. We can always treat things in the future, but having kind of more of that prevention focus allows us to be prepared, if anything else similar happens in the future. Some challenges, like I said, even though, we've talked a little bit more about resources, there may not be as many resources in certain communities. And so because of that, they might be not getting the access to care that, all the animals or medical, or excuse me, the patients need. A lot of the times there may be gaps in the knowledge, either intentional or unintentional, we could always be doing a better job of making sure that we're following all practices and we're aware of, what diseases are in the environment. But also in terms of like differing priorities. And what I mean by that is, environmental health officers may have a different priority because they are looking at it from an environmental standpoint, while medical, providers are their priorities more so the single patient. So kind of finding a way to figure out what is the common goal and move forward with that. In terms of, what's the other big thing that we've learned from this is enhanced understanding. So I've talked about how all the pathways are integrated, but it also comes into point of how we as a community are in an entire system kind of thinking, meaning that it's very collaborative. You know, we are working with the government, we're working with veterinarians, we're working with stakeholders. This all, requires collaboration. It gives us that more focus on transcending traditional boundaries because not everyone is limited to their role. Everyone finds a way to work together. And it kind of highlights, what this class has been talking about on, One Health approach, meaning like, what does it really mean? It really tries to enables us to move from more of a, reactive outbreak management to more of a proactive health systems management. So it kind of just sees how everything is linked together, whether it be to the extent of the animals or humans and, the shared environment they have. So this kind of has, give us a further understanding of this case.